Good morning, everyone. It's my great opportunity to be in front of all of you, and big thanks to the organizing team for organizing this session, because India is the place where healthcare is, I would say, most ignored subject, which not basically been addressed by most of the startups or our government system even, I would say. See, I'm very open, very aggressive. I don't do buttering and those kind of thing कि नहीं यार मैं government से मुझे डर है या उससे डर है नहीं. I tell you the fact. What is happening, what is required, how to fix, right? What preparedness we already have, what we do not have, what we want. What is the pathway for solving and addressing those issues? I stop here, and I think I'll ask our moderator, Nitish, to give more. Yeah, thank you.
Thank you, Ambassador Singh. And thank you again. Good morning, everyone, for this nice and, I would say, more pleasant Delhi morning today in comparison with some of the other days. So glad to have you folks as part of the audience here. Just by way of quick introduction, I'm Nitish Jain. I work with Deloitte. I call myself a career consultant. I've been in the consulting business for about 24 years now. And I focus in the digital and tech space, focused on all things life sciences and healthcare. And in that context, happy to be part of this discussion with Ambassador Singh, where our intent is going to be to talk about, basically start with what is AI and its implication from a healthcare perspective, and then dive into some of the opportunities that we see in the marketplace, as well as some of the challenges that we have. Obviously, we'd love to keep it interactive, so open for questions if you have any. But obviously, we'll try and keep some time at the tail end as well in case you have questions. Fair? Just wanted to check on that. And Ambassador Singh, if you wanted to just start with a quick intro for yourself. I actually missed that one. I have been a serial health tech entrepreneur for last 30 years. I built more than 17 some of the world best deep tech health tech startups from scratch to multi-billion-dollar global multinational companies in healthcare by revolutionizing the digital health, AI health, medtech, and surgical robotics in more than 50 countries, local settings globally, right? Working into particularly in the deep healthcare areas, which is basically related with the chronic disease management, I would say the non-communicable diseases such as cancer, diabetes, heart disease, mental health, COPDs, women's health, which is other than NCD, and then in COVID-19 kind of disease, which is coming under CD areas, communicable diseases, COVID-19 and emerging and re-emerging diseases, infectious diseases like COVID-19. And today, like we are saying, in China, that virus has come, that will come in India, and like that. So those are all basically, I would say, the family of emerging and re-emerging infectious diseases. I have been also working with the WHO Geneva as an expert member for digital health and AI health, working with more than 40 countries, governments as a think tank leader for rolling out digital health and AI health for NCD and CD areas in different local settings as per the different countries' challenges and opportunities. Currently, I am the founder and CEO and board chairman of Benovymed Healthcare Group. Benovymed Healthcare Group is a billion-dollar global company with 9 business verticals,
all in healthcare. And we are working on the NCD, CD, and women's health related disease from end-to-end technology solutions powered by digital health, AI health, and medtech. And we also have one of our unit business vertical, which is basically working on manufacturing of surgical robotics, multi-speciality surgical robotics with AI. So these are some of my key areas where I have been working, and we are working very hard and solving, more than, thousands of complex problems existing in our real healthcare ecosystem in India and across the world. So that's my background. Now coming to our today's point, AI, the future of AI in personalized healthcare. So I think this is a very needed area which need to be addressed and work upon by all the stakeholders, not just by startups or just by one or two companies, but all the stakeholders. When I say all stakeholders, that means including the investors. Because without investments, without right ticket size of investment at the right time with the right startup, we are failing whatever we are claiming, right? We cannot build a good healthcare ecosystem unless we have good, investors, a good government support system, unless we have, domain expertise in this space, unless we have people who understand the meaning of regulatory, who respect the regulatory, who understand the value of responsible AI. I tell you, responsible AI is something which is, for last couple of years, it has come in the global market. Because earlier, there were a lot of applications have happened with the AI in healthcare, but they have created more problems than solutions, more damage to the healthcare ecosystem than solving any real complex problem existing in our healthcare ecosystem. That's why responsible AI was basically introduced. And when I worked during COVID time with the WHO Geneva, I was the first person who raised this voice at the United Nations level on behalf of WHO Geneva that AI is fine, but unless you have responsibility, liability on the stakeholders, including the startup or the company or the provider who is using that, it is meaningless. It is meaningless. Because it is like you are having a Ferrari car and you are driving in our Indian roads, which are having all so many pots and animals and buffaloes, and those are coming and going, and cycle wala and rickshaw wala are going, and you are driving a Ferrari, and you will kill so many people every day, right? Because technology is fine. Unless you have the regulatory in place, safety in place, quality delivery in place, technology is not going to solve the real problem. Because when we talk about technology in healthcare, it is not like selling tomatoes and potatoes on e-commerce platform or selling medicine, right? Those technologies are just for making those logistic enabled, but not talking on the clinical point of view, the clinical efficacy, the quality delivery, the treatment outcome. They don't talk about those. What is required is that when we use AI, because AI as such, it is very powerful. It is the most powerful things on this earth today. But unless you know the subject, unless you have the domain expertise in healthcare, in technology, and in its business execution in the right manner and in a responsible manner with the privacy and with the confidentiality related with the patient records and patient data, you are creating more problems. And that is what is happening not only in India, but all across the world. And that is why many countries, governments, now they are coming in front. European Union, they are coming in front. They have created a law for AI in healthcare with lot of stringent regulation and privacy related issues. Even in US, I'm also, for your information, I'm also special advisor to US government at, for Department of Commerce for AI in healthcare. How AI in healthcare can be rolled out for US people, right? So things are very, very challenging when we see on the ground. Like India is a place which require AI in personalized healthcare. Why? Because what is personalized healthcare basically? Let us try to understand. But like up to now, what we have seen in our Indian scenario is that patient has to visit to hospital. They have to consult the doctor. Unless doctor gives the clinical advice, the right advice, patient cannot move to the next level about his treatment or other care plan or whatever is required for managing his disease, right? So that trend has to be changed, especially for India. Why? Because India has huge population. India is not like Finland, or India is not like other small countries where the population is 1 million to 5 million, right? So to address the population-related issues like India, where hospital and government system is crying every day that we require more number of beds. In my opinion, we don't require more number of beds. If we focus on prevention of all these health-related problem related with the NCDs areas especially, because NCD is what? NCD is a slow lifestyle-related disease. It's not like fever you get today and tomorrow by taking paracetamol it will go out. No. It comes slowly and it remains for long time, and maybe it will not be cured at all, depending upon what is your stage of your medical condition related with these NCDs areas, right? So with AI, the personalized healthcare can be basically modeled and rolled out for solving I would say, the number of beds related issues that with AI, when we provide a powerful tool to the patient, so that patient need not to visit for every single small issues to hospitals, to doctors. Thereby, we can stop the crowd going to the hospital. Like in our Benovymed healthcare group, what we did, we created such a very robust technology platform which is powered with the AI and digital health and medtech, where we are stopping 90% of the population not to visit hospital. We can manage with AI and these novel next generation technologies by just keeping a patient at home or at office, or without visiting hospital, they can manage their chronic conditions, non-communicable related disease they can manage. Only for any critical issues or for some emergency issues or some surgical intervention or some CT scan and those kind of critical diagnostic, then only they need to visit hospital, but not otherwise. Today what is happening, patients are visiting just for a small problem also, just maybe for, they do not understand some dosage problem with their Medicare, right, related things. So they will just go to the OPD, get a registration done, unnecessary. And that's a 2-minute job. So those kind of 2-minute job or any of those secondary issues which are in and around clinician, that can be managed with AI. And that can be managed where the patient is provided with the powerful AI tools, so that the patient can see on their app, right, all their medical condition, the real-time medical condition. They can see the traction, what is happening with their health. Their BP is going up or down. Their diabetes is going up or down. Their cancer-related treatment plan, what kind of plan doctors has recommended, and which day what they have to take, what kind of medication they have to take, right? What kind of exercise they have to do, what kind of food and those things they have to maintain. So everything can be personalized through AI technology, so that they don't have to consult for small and simple things with their clinician, unnecessary. Because the platform is so smart and powerful that it will guide the patient with each and everything, whatever they require, whatever they ask inside the hospital, right? So those kind of the things are there. Maybe you can ask. I think I'm just non-stop. I'm talking. Maybe you can ask some questions or something like that.
No. So I mean, Ambassador Singh, that's his passion. Obviously, that's reflective of the work that he does. The only things I will add is just restating what Ambassador Singh said. In simple words, obviously we are aware of a use case of someone falling sick, going to a doctor, or the preliminary questions of what's the family history, what's your history, and so on and so forth. I think what we are at this cusp of what AI can do or make a difference in this very simple use case is AI can not only look at your personal data, personal statistics, but also be able to farm out into the ecosystem and the data that's available in terms of the genes, how they react to certain diseases and symptoms and things like that, and what role a variety of other circumstances can play, and put all of that together to make very informed, personalized recommendations to a patient and a clinician, right? That's the power of what AI can truly bring to the forte, right? A few data points I will throw out, and fortunate and unfortunate, these are facts. 800 million, okay? This is the number of people in the world who will be more than 65 years of age in the coming year or two, right? So we're almost there. So think about the volume of people who will be needing healthcare in the coming years. 540 million. That is the number of people who will be suffering from diabetes in the next year or few years. We're almost there. And this number is increasing double digits. 1 billion is the net increase in population that has taken place in the last few years. So the point is, population is growing, diseases are growing, life expectancy is growing. So bottom line is that if we really want healthy aging as we use it in the healthcare domain, then we have to embrace technology, and AI can play a big role in that ecosystem. Okay? Ambassador Singh, if you want to talk about some of the opportunities in the context.
I think challenges also
Absolutely.
We need to discuss, because we have not, I think, discussed the challenges.
Absolutely.
See, in challenging side, if you see, there are many factors which are making AI successful and creating the future. Some of the points I would say, like the funding from the banking system, from the government, from the VCs. These kind of things are actually not available in India as of now today. Because whatever you listen, see on the media from the policymaker or from the high chair, from the government, those are all on the media only, not on the ground at all. Because all those fundings are working on favoritism basis, not at all. Because I tell you, in India, I would say at least 100 some of the deep tech, health tech startups are there who are doing a wonderful job, but they are not having access to fund, right? And the cost of raising fund is also very high. People are not aware of that. It's very, very high. So my question is to the high chairs, why you made such a startup ecosystem? How startup will grow? Because in this kind of scenario, you are only growing to online shops. Online, you're saying online startups who are working on marketplace. Because marketplace is not a startup in my dictionary. Because I built, I would say, like I was saying you, I built half dozen Israeli health tech, deep tech startups. So the Israel is the real startup nation, not India. We are misinforming the world about startup in healthcare. We do not have the culture of startup because startup culture starts with funding. The selection and rejection of which startup you are funding, which startup you are not funding. You are funding to some of the hopeless startups. And not just funding, but you are dumping millions and billions of dollars unnecessary on those kind of startups, which are making more problems than solutions. Nobody talks about that. No media talks about that. I think the purpose of the media is to put in front, address these areas, because media job is the journalism. Journalism is to bring the fact, bring the real pain points, not to hide those, which is not happening here in India. So how you think that we can have a Viksit Bharat? Viksit Bharat has to start from ground zero, not start from media. We have to start from zero. See, Indians are very brilliant, but when they are staying in India, they are not cared, the brilliant people. When they go outside India, in US or like that, they are most respected men because they are using their mind supported by those ecosystem. So that is not here. So first milestone of success in this AI in personalized healthcare or AI in general in healthcare is this only, because AI require lot of capabilities, not just the funding, but the domain expertise, but the data. If you see in Indian scenario, the data, when I was with the WHO, I was telling to government of India hundreds of times about cleaning the data, formatting the data, making the data uniform. But what is happening today, if you are a startup, you are approaching the government or any hospital, everybody will say, no, we will not share data with you. But off the line, I tell you what is happening in the system, but nobody talks on the stage. I only talk that. If you pay few crores to hospital or the system, you will get tons of data. Tons of data. So how can you make the future of AI in healthcare like this? If you give tons of data by paying to someone who do not have any domain expertise, who do not have any capability in healthcare, in technology launching, in commercializing these and monetizing these kind of novel technologies in healthcare, how can you get the future with this? You're not creating the future. You are killing the future. Right? We have to stop killing this future of this kind of organized crime, what is happening in healthcare. Because today, whatever you see in the media about the Sunicon, Unicorn, or all those big funded startups, what they are doing? They are only selling medicines. The purpose of medicine or healthcare is not pump drugs in your stomach like a food. You have to take food like a medicine so that you don't have to take medicine like a food. That is why the government is also silent promoting this kind of e-commerce platform which are pumping, supplying medicine to the end user unnecessary. And doctors, many of the doctors who are sitting inside the hospital, they become the agent for those companies, for those pharmaceuticals. They are unnecessary, they are recommending medicine. The purpose of the physician or the technology or the medicine is not to pump unnecessary to everyone. Like a number of tests. There are many of the tests which are unnecessary recommended by the physician in the hospital, especially the private hospital, not in the government. If you go in the government hospital, they will recommend only minimum possible medicine and minimum possible test. Why? Because their objective is from clinical point of view. Their objective is not for greed of money. Whereas in the private ecosystem, why it has been created and nobody is talking about that. Nobody is stopping that. That has to be stopped. And the healthcare leader are the people, are the stakeholder who can stop this. But they're not stopping that. So we need to stop that also. Right? Then, so this is related with the patient privacy, data privacy and confidentiality. So that is not maintained. On paper, we are saying it is maintained, but if you pay money, you are getting tons of data. That is what is happening, which is bad, which nobody talks about, which has to be stopped. So privacy has to be there, patient data privacy has to be there, patient, then the responsible AI has to be in place, not just simple AI or not just fake AI or hype AI. It has to be responsible AI with liability and accountability. When you are claiming that, yes, our AI is going to deliver this, it should deliver. If it is not delivering, if it is giving misinformed, then you should be liable. That is the job of regulatory. That has to come in place. Otherwise, everybody's talking about AI, I have AI. You open the LinkedIn, you know, the first word you see on the top is AI. So people have misused the power of AI. We have to control that and use in a right manner for right problem-solving area, not just for the fancy word from that point of view. So that is the other area, and then I think I'm missing something.
No, the only other one I'd call out, right, and by the way, if anybody has questions, please obviously raise hands and go ahead. Why don't you ask your question and then we'll go ahead.
Thank you. I'm Gaurav, a software engineering manager at Gartner. My question is around adoption challenges that we were discussing a few minutes ago. If I take an example, let's say you put the personalized AI healthcare in order to prevent people from going to the hospitals, right? I think the challenge is around adoption. For example, my parents, they are used to always going to their local doctor. They would say, "Mere ko ye sab nahi samajh mein aata. I'm not going to go there."
Correct,
right?
Correct.
So how do you get ahead on that? Because how do you build that trust? Right.
So
Second,
so that is one of the point which I already have mentioned you, but I have not discussed right now. So you raised the right point. Adoption is the real challenge, especially a country like India, where I would say maybe more than 70% people are not that level educated. They are educated, but not the level what we are expecting in terms of AI, and because they are hardly able to use smart phone for seeing some WhatsApp or for videos or those kind of messaging. But they are not still very friendly and adapted with the usage related with the healthcare, right? So those are the challenge, and those are basically can be managed in a very different and phase by phase manner. Not like just today you roll and expect that whole India, billions of population, they are going to use. No, we have to use it phase by phase. Start from top to bottom area. Like people who are well educated and Then from there, you can come down to the lower side. But for lower side, you cannot expect that they can use smartphone for this kind of application. We have to create a community and connect the community with their smartphone for educating and mentoring those people related with how they can manage their problems, their medical condition, using these smart solutions, on their smartphone, right? So those things, those area, like especially in the rural area, if you talk about to cover your rural area with this, those are some of the challenges. But we, as a company, we have also basically addressed those problems. What we did is we created a voice to text, right? So that the patient who are from the rural area or who do not want to use these smart solutions, smart phone, they can just talk, they can speak. So when they speak, then our technology platform, our think tank basically that convert voice into text and text into computing through our cloud system, and then it give back the required result solution in again on the voice mode and on a video mode also, just like a doctor. Yeah.
So unfortunately, I think we're running out of time. Apologies. And obviously, this is a vast topic with a lot of topics.
Yeah,
and
a lot of things can be
that we talked
discussed.
through.
Yeah, correct.
So
Correct.
I think I'll offer up to linger around for a little bit longer. If you want to carry some conversations further. But truly appreciate your attendance into this. And Ambassador Singh, thank you for taking the time. I know you have a question. If you can just voice your question, and we'll probably take it offline. Apologies, I know, because we're getting the nasty stares and we started a little bit late, so apologies. But go ahead, please ask your question.
So I was just curious, and I wanted to ask that what is the potential for AI to predict and prevent diseases before symptoms appear, and how close are we to achieving this mainstream healthcare?
Come again.
Okay. What is the
starting point, yeah?
potential for AI to predict and prevent diseases before symptoms appear, and how close are we to achieving this mainstream healthcare?
Yeah. We are doing that. We are very much involved in that, because we have the technology. Because to develop all this, as I mentioned, we require these parameters. If you qualify these parameters, you can build a very successful AI-based, personalized healthcare. The parameter, as I said, those domain expertise is must. Because if you do not have the domain expertise, not only in technology, but in related with the clinical practice side, related with the business execution, how you are going to, because you develop the technology, but how to adapt and how to monetize that. Why people will use your technology solutions. Because what is happening, most of the startup, they are trying to sell the technology to the market. Nobody is going to buy technology. The end user want the solution. They don't care what technology you use, AI or whatever you can give the title. They want what best result, what areas of practice or solutions you can provide them smartly, intelligently, and accurately with responsibility. That is what they are expecting. As far as that is delivered to the patient along with the privacy and those things, they are able to adapt that. Because ultimately, if the technology has this vision of accessible, affordable, quality and safe health to all, it is going to be successful. That is what we are doing in Benovymed Healthcare Group. We are making the technology accessible. We are making the solutions affordable. We are making the solutions with the highest quality delivery, right? And that is why people can use it. Because if the technology is accessible but not affordable, no use. It has to be affordable, it has to be accessible, it has to be safe, it has to be quality, and for all, not for one favorite class of people. Right? We have to cover the entire people if possible. Because billions of people in India, they are struggling hard for getting health care. People are living in false hope. People think that if they visit hospital, they will get cured. No. Hospital do not cure you. Hospital is doing business. Means I'm telling you the naked truth. Hospital is doing business. They don't care you are alive or dead. No. They care how much time they can bring you to the hospital for making their money, for meeting their VC-funded targets, right? That is what is there. And the doctors, the physician there, they are pressurized to follow those rules under their ethical, so-called ethical rules, right? So those are the things. It is you who have to decide when you take this AI-based personalized care, then you can stop your visit to the health to the hospital, because you can many of the things you can cure yourself. But as of today, you are not provided a powerful tool like this. If you are provided like this, without visiting hospital or without consulting, when you are engaged with the platform, you are able to treat yourself, you are able to care yourself. Only in case of a critical condition, most critical condition, whether it is surgical or any advanced stage of, say, cancer or any of those things, then you require to visit hospital. But we need to focus more on the prevention side, early detection and diagnosis side, because if we stop disease moving on the other side, right, we can basically prevent it. We can be more healthy. We don't require too many hospitals. We don't require too many beds, right? So we have to focus on prevention. And with this smart solution, we can prevent it. Thank you.
So in short, I'll just say one sentence and I'll close it. So we are more closer, I think, from a preventative, predictive perspective than we all think we are. Simple example being, and I'm not marketing this by any manner, but I'm wearing this smart ring, right? This predicts, before my wife knows I'm stressed, this tells me I'm stressed. This tells me I'm skipping a heartbeat. This tells me that, you know, I took longer to sleep today than I did. And if it is a pattern, then what are the repercussions of that? So again, point being, there's a lot of that prediction, predictive ability that is there. I think what Ambassador Singh mentioned about the responsible AI and connecting those dots in ecosystems is where the work needs to get done. But I think technology perspective, we're closer than we think we are. Okay, I'm going to stop at this. Apologies. Like I said, and we'll take it offline. But thank you again for the time. Thank you, guys.